and we are going to have a tutorial with Bruna. We already had two of them. One was how to choose a tattoo artist, and the other one was on eyebrows. This one here is going to be on eyeliners. Hey, you want to say something? On eyeliners and lip liners. So let's get started right now. Good morning, Bruna.
Hi, Maria. How are you?
Oh, I'm really good. And
Good.
I'm wanting to thank you for spending the time with me. Bruna, you are a beauty therapist. You've done everything to do with aesthetics and body care, electrolysis. And now you're mainly focused on health and wellness and on permanent makeup. So
Right.
does it hurt? Now, I know like on the eyebrows, I've had it done and it's not too bad, but I've never had on my lips or eyeliner. So I did not know how to answer. Does it hurt, Bruna?
There is some discomfort for sure. The freezings that we use that are available to technicians are quite good, and some are not. So there are some products that are better than others. I would say that most people have they have some discomfort during the procedure, but once it's frozen and the freezing has taken effect, it is not a massage, put it that way. But it's doable. No one has ever told me stop right now. I can't do this.
Oh, okay.
Yeah, so it's manageable, and if the technician is good at walking the client through the procedure, making sure they explain as they go through, it's quite tolerable.
Okay. Does it last forever like a tattoo or does it fade?
Are we talking about eyes and lips or just eyes?
I'm going to focus right now on eyes.
Okay, okay. So it doesn't last forever. Keep in mind that when you do a body tattoo, the technician, the tattoo artist, will go quite deeply into the skin.
Okay.
Now, obviously, we're at the lid area, we don't have a lot of space, right? Your eyeball is right there.
Yeah.
So the technique needs to be done quite shallow. The colors that we use for tattooing, if you were to shake a bottle of a tattoo color for body, sounds very liquidy.
Mhm.
Whereas with the tattoo for cosmetic tattooing, those pigments sound more creamy, more cloddy, and so
Okay.
they're thicker. They don't last as long. One, because they're more neutral colors,
Okay.
and two, because we don't apply it as deeply as you would a body tattoo. Having said that, it does last a long time.
Okay.
My client will come to me every 5 to 8 years to redo the eyeliner. Yeah.
Ah,
Sometimes longer. Sometimes it can last longer, and I don't know why per se. It could be the individual customer's skin, acidity. If they are anemic, if they have iron deficiency, the color will dissipate quicker.
okay. Are the colors safe?
Well, the colors are safe as a safety. Is there a lot of metals? Most of the pigments, I think I mentioned this last time,
Mhm.
the manufacturers of these pigments, they don't require FDA approval to make the pigments, but they will take every precaution to make the colors as safe as possible. Some are mineral, iron oxides. The pigments themselves, you'll probably get more metal content by eating a piece of fish than you would having a procedure, tattoo procedure. Keep in mind, there's people that tattoo their entire bodies.
I know.
We're doing a very small area and it's very superficial. And yes, the colors are safe as long as you're not making them yourself in your.
Yeah, and that's a question that I have. I don't know. My girlfriend had her eyebrow, no, sorry, her eyeliner done,
Mhm.
and it turned blue. Now I wanted to do it too, but I'm
Yes,
kind of scared now because she had like a color. I think she wanted like a brown black, and
yes,
now it turned blue. What
yes.
happened?
So that can happen with the eyes for sure. The colors that are done for eyeliner, they're closer to tattoo pigments. And remember that your colors, black is made from red, yellow, blue.
Okay. Oh
And
yeah,
what happened? Okay,
the color
imagine,
wheel. Yeah,
yes, imagine if you were to color your hair red.
yeah.
In time, that red fades. But if you color your hair pitch black, that stays black until you get that regrowth.
Yeah.
That's because the blue molecule is much bigger and stronger than the red and the yellow. So as the yellow and red molecules dissipate through the tissues, through time, through blood flow, that blue molecule remains. So that happens with anyone. Some people more than others, depending on their skin tones. But even
Mm-mm.
if you look at traditional regular tattoos, as they get older, they do have a tendency to get to a bluey, green, gray.
Okay.
That's just the nature of tattoos. And for the eye area, that's when people would come back and have it redone. So the liner is not gone completely,
Yeah.
but it needs to be refreshed.
That makes sense. So another question, I actually have two questions. Will I get infections? There's a risk of infection. And will my eyelashes fall? Because you're so close to the eyelashes.
Right. So I'll answer the lashes one first because I get that a lot myself.
Yeah.
Clients say, I heard my lashes are going to fall out.
Yeah.
Okay. So we don't go as deep as the papilla of the follicle.
Okay.
So imagine your hair structure, the growth pattern, right? The anagen, catagen, telogen.
Yes.
If the hair is already on its way out because it's being replaced by a fresh one, then yes, the tattoo needle could
Pull it
help
out.
that one.
Yeah.
Okay. But if it's anchored deep in the papilla, it does not do that. In fact, that injury to the lid creates blood flow that for some people makes their lashes longer. But I
Wow.
tell them that's temporary.
Okay.
Don't count on that lasting.
Yeah.
So is it removing the lashes? No, it's not.
Okay.
And if it does remove one because it's already on its way out through the growth pattern, that
Yeah.
will come. Infection. In regards to infection, like I said, the regulations for safety, that protocol, the health regulations are quite robust across Canada for sure, because where we have here's Fraser Health, Coastal Health, they check regularly. So as far as infection, when it comes to products, very unlikely.
Okay.
The colors come in bottles that you drop out with a little dropper or the little lid. There's no cross contamination there. The tools, the needles are hermetically sealed. There's no cross contamination there. What can happen? And I have a little bit of OCD when it comes to this, is when the technician is in the middle of a treatment and then reaches for a bottle, and then that could be cross contamination.
Got
So
it.
it's up to the technician to stop, remove the gloves, mix more color, put new gloves on, get back to the treatment. Sometimes people are sensitive to the pigment, sometimes they're sensitive to the anesthetic and can get a little redness. But that is something that during the consultation you would be informing your client. Infection can happen, of course. Sometimes it's the client themselves not treating it properly, the aftercare.
Okay.
But in general, if the procedure is done correctly, if the aftercare is done diligently, there shouldn't be a
What
problem.
I noticed, Bruna, is that they're all kind of different. Like us, and so, but I've seen other artists' work, and they all look the same. But
Mhm.
yours, it varies. Why?
Because everyone has a different eye type, and anyone who's done makeup as a profession will know this. But
Okay.
even if you are not a makeup artist and maybe you have a deep set eye or a sunken eye, and you look at your girlfriend who had more of a prominent lid, had a nice thick liner, and you did a nice thick liner on yourself, and it didn't look quite the same.
Yeah.
Because everybody has different eye types, right? We look at the size of the lid. How big is the moving lid? There's a stationary lid, there's a moving lid. Do I have droopy eyes? Or my eyes upward? If I
Yeah.
have a droopy eye, we don't want to do heavy lower liner because it would make it even droopier. So that has to do with assessing the eye type. And sometimes when you take a short workshop,
Mhm.
that's not covered.
Yeah. Yeah. So basically, you're analyzing the eye if she has closed set eyes or wide set eyes, up and down. So give us an example. So if somebody has closed set eyes, will you go all the way in, or how would you do the
Okay, so
eyeliner?
let's see. Let's, for example, somebody that has the eyes are set close together.
Yeah.
If we take the eyeliner all the way in,
Yeah.
then it would make the eyes look even closer. So what we do with that type, we would keep it right at the lash line, nice and thin. Stop where the lashes stop, and then elongate it outward, maybe a
All
little bit
right.
fuller, a little bit lifted. Reversely, if somebody has wide set eyes, we
Mhm.
would bring the eyeliner all the way in
Okay.
to correct that.
So another question that uh, I have a student that she's going to get the treatment that called the blepharoplasty.
A blepharoplasty.
Yeah,
Eye track. Eye track,
yeah.
yes.
And she asked me, should I do my eyeliner before or after?
It really depends on how much the blepharoplasty is needed.
Yeah.
If the lid is falling onto the lashes, then do the blepharoplasty first. Because once you remove all the skin, then the technician can give you an eyeliner for your current eyes.
Okay.
Because if you do the liner before, the technician will have to do a liner for a sunken eye, meaning that that moving lid is not very visible.
Yeah.
So they will
Okay.
be able to do more of a liner, maybe a little bit thicker if the skin is not there.
So you advise the surgery first.
Surgery first if the skin is quite, it's folding and sitting and resting on the lashes. If
Okay.
it's so, if it's okay, some people say, well, I don't know when I'll be doing the blepharoplasty. Let's go ahead with the eyeliner. That's a
Okay.
conversation you have with your technician.
Technician. Okay. Okay, let's go now a little bit on the lips.
Sure.
Uh, will I get a cold sore? Because
Right.
I've
Good
heard
question.
that.
So, yeah. So, one of the consultations that I do before they come see me
Yeah.
is I put them on an antiviral.
Yeah.
So,
Oh,
yeah, an antiviral is basically people that suffer from cold sores are very familiar. There's different brands.
mm,
They would have to go to their doctor or to the clinic.
yeah.
And now it's very easy to get an antiviral medication because lip procedures, whether they're tattoo or injection, are much more common.
Okay.
So I just tell my client, just go in the clinic and say that you're having a lip procedure. I send them the aftercare and they'll get the Valtrex. And they're going to start that the day before to prevent anything from happening.
Yeah.
I've had some clients that say to me, I have never had a cold sore. And I say to them, you do your procedure at your own risk
Yes.
because it's a very common virus. And some people are just carriers, right?
Yeah.
They don't have flare-ups, but you never know. This kind of procedure could cause a flare-up.
Will this procedure make my lips look bigger?
That's a good one. So the lips are a very interesting canvas.
Okay.
We have the lip part that is highly vascularized,
Yes.
and then if you try and make it bigger, we have the skin part, which is a different color, different texture,
Okay.
and there's the vermilion border. I always joke about this. The vermilion border is actually not vermilion; it's white. It's
Oh,
that white part between the skin and the lip.
okay. Okay.
That gets bigger as you get older. It gets lighter and lighter and lighter. We can work on that border. We can work
Okay.
on that border so we can correct the shape. We can make it a little bit more even.
Oh, okay.
But I highly discourage going outside the lips so much that
Yeah.
you have lip color on the peach fuzz area.
Yeah. Yeah.
One, it's a different color and it'll always be a different color. And
Mhm.
two, there's little fine hairs there. So the
Yeah.
lipstick will look fuzzy.
Lip fillers. Should I get my lip filler before the liner or after?
That's a difficult question to answer because people are getting fillers, women usually getting
Yeah.
fillers all the time. So I used to say, get the liner before. And even when I worked in medically led aesthetic clinics,
Mm.
the technician, the doctor would say, get the liner first because there I have a different line to follow.
Yes. Yeah.
That was always, but now with fillers being so common, that question doesn't really come up anymore because they probably already have some filler.
Will my lips go blotchy?
They can go blotchy. The reason for that is imagine if you do the lip color too shallow, if the color is too shallow, the color will disappear.
Okay.
If you do the color too deep, the color will disappear because there's lots of blood flow,
Ah,
right? So
yeah.
you need to get it nice and even in that edge, right? Not
Right.
too
Yeah.
shallow, not too deep. And so it requires more than one application. Same with the eyes. You got to be careful not to go too deep or too shallow
Yeah.
because you can cause bruising and you can cause color migration because it goes into the blood vessel and then it kind of fades out and it doesn't look good. So you really need to make sure that you get that color in
Mm.
just that right layer.
Question. What is the difference between lip liner and lip shading?
Preference.
Okay.
I discourage lip liner.
Oh,
Although I had a client recently that really insisted on it, and it turned out really, really well. Lip
okay.
liner, if you're asking for a dark outline, that's easy to do.
Okay.
If you're asking as a liner to try and emphasize or maybe fill in the lip a little bit, to
Okay.
get an exact match, is not easy because the lip color themselves change.
Yes.
If you're warm, it's a different color than when you're cold. So to try and get a match is hard enough if the lip color stayed exactly the same all the time. So that's very difficult. To do lip shading, however, a full lip color is very nice because you don't have to worry about matching the lip exactly. And it's almost like a layer of color and it looks very, very nice.
Yeah, I've seen some of your work. Now, will it cost more when you do shading versus liner?
Absolutely. You're talking about a bigger area. Liner
Okay.
it's much quicker. It's you're talking about just the outline of the lips, where to do the color. And remember, the color does not look necessarily even all the way through. I mean, the more experience you have, the better you're going to be.
My friend bought a machine. It's a tattoo machine. And should I go and get the treatment from her?
Well, you want to.
I guess she's going to practice on me.
And there is a level of practice time that new technician have to go through. So is she a good friend? Do you want to support your friend? Yes. Just know what you're getting into, right? You want to make sure that she has some level of training, that she's not just practicing on you with no training at all. And make sure that when you do the consultation with her, you feel comfortable, knowing that this is a new person working on you.
Bruna, I will be making an appointment with you. I have only one face. I'm sorry. Some technicians are charging well, and some of them almost as basically a makeup application. So why? Why is that?
Well, I would say that if it's just the price of a makeup application, run. To remember the cost of the products, colors, needles, they don't vary very much. What does vary is your location. So if you're from LA, California, you might pay more than if you lived in Kansas or Saskatchewan versus Vancouver. So it's supply and demand very much. I've been doing this for over 30 years and I haven't increased my prices. When something new comes up, I want to be fair. So my prices are not cheap, but they're not the most expensive. There's people in my city that charge double what I charge. And that's because it's something new. Everybody's looking for it. Like microblading was big. Now the prices are equalizing a little bit. When it first came out, it was very expensive because it was this new natural look. But I looked at it and thought, okay, I've done that before with older tools. The tools don't cost me, the technician, more than a tattoo. So I kept my prices the same.
I don't have any more questions, but how can you conclude these 3 segments?
Well, I would have to say that permanent makeup is wonderful. I mean, you've seen the photos, they're great. Once you have it done, it frees up so much of your time that it makes life better. Keep in mind that it's not a permanent solution. It needs to be redone every so many years, but it's permanent enough if it's not done well. So be sure to look back at the series that we did together here and make sure that you're doing your protocol. Make sure that you find the right technician, ask the right questions, look at the photos, feel completely comfortable before you have any procedure done. Worrying about ever having to put on or smudging, and this will continue to be a great service for many, many years.
Bruna, thank you so much. And we will meet again. We have a lot more things to share with our people. And I will talk with you very soon.
Well, thanks for asking me and have an awesome day. Take care.
Thank you, Bruna.